Hi, I'm Dr. Abdollahi with California Advanced Pain and Spine Specialists. We often have a lot of questions asking us about spinal cord stimulators and exactly what it is. Most people think it's like a TENS unit. I wanted to spend just a minute or two to talk about exactly what it is and how it works and what we use it for. Spinal cord stimulators are basically stimulation devices that have high frequency vibrations that through various reasons help decrease the pain that patients have anywhere along their spine or in their arms and legs. Depending on where we place these electrodes, we can cover lower back pain, mid back pain, or neck pain. And simultaneously with neck pain, we can control arm pain, and with lower back pain, we can get leg pain. The way it works is there's two electrodes that go into the epidural space. It's very similar to laboring patients who get epidurals. And what is the epidural space? It's a space that is behind the spinal cord and the spinal canal. It's the closest you can get to it without actually getting to it. And what we do is we put a couple electrodes in through the back, and they run up the back and either stop here or go up here, or keep going up, depending on where we want them to be. And what they do is they vibrate at a high frequency. With some companies you can feel it, and with others you don't feel the vibrations, but we can change it to anything the patient wants. But the eventual goal is to reduce pain without any medications using the stimulator. It's done under sedation. Patients are completely asleep for the whole thing. Also, with this type of product, we do a trial before we actually place the stimulator. During the trial, you have a 1-week test session where we put the electrodes in, connected to a battery on the outside that powers it. You walk around all day for a week, and you see how your pain's treated. If at the end of 7 days your pain is well controlled and it's something that's been beneficial, then we talk about putting it in permanently. If it doesn't work, there's no harm done. The two little electrodes come out and it's as if we never did it. They're placed very simply. It's just two little needles that get into the space to allow the electrodes to go in. It's done under sedation. You don't feel anything because you're asleep, and afterwards there really isn't much pain because there's never been any incision done. Afterwards, if you need to implant it, we follow the same procedure and we implant a little battery pack with it too. You can tell they're very thin and quite small, and they connect to the electrode and keep it powered. These charge very quickly as well. Usually once a week for maybe half an hour or an hour, we'll keep this thing going on, and it just goes on forever. There's multiple different diseases that cause lower back pain or neck pain that this treats. It doesn't really care what the cause is. It does a good job of just controlling the pain regardless.